attendee list. Um, Sarah, would you want to start? It's 10 o'clock. Do you want to do a quick introduction?
Absolutely. Thank you so much for everybody joining us this morning. My name is Sarah Hemming. I'm the Member Relations and Education Manager here with Leading Age Maryland, and just excited to be celebrating this event for National Day of Yoga, which was, I know, yesterday, but grateful to be with all of you for this conversation. I look forward to learning a lot, but then also doing some practice of yoga as well at the end. So thank you all so much for taking the next hour to join us and learn. So thank you so much. Appreciate it.
Thank you, Sarah, for that nice introduction. Again, welcome everyone. Thanks for joining. My name is Saurabh Shrivastava. I and Vasumurthy here, we both belong to this organization called Vayu Shakti. Vayu Shakti is a holistic wellness and integrative wellness organization. I'm also a student at the Vayu University, where I was very fortunate to have Dr. Sarkar as a faculty. I also had the vice president of Vayu University, Ramki Ramakrishnan, who came up with this idea of Vayu Shakti, which was essentially about not only teaching yoga, which the Vayu University obviously is doing and is continuing to do, but also applying it to the real life problems and taking it to the masses. Our goal is to make what is today called as the alternative medicine, to make it mainstream. We all know, and that has been accentuated by the pandemic, that when it comes to the modern medicine, it is extremely good for infectious diseases, for diseases which are originating from outside of your body. But when it comes to what is called as the non-communicable diseases or lifestyle diseases, it is not as great to take a pill and then hope that all the ills will go away. It is there where all these other forms of medicines, which are today called as alternate medicines, they are much more effective. That includes yoga, that includes other forms of things that you do from within your body to make your own body and your own food as the medicine. So that's what the goal of Vayu Shakti is. We are currently operating primarily in the New York City. We were present at the Leading Age Maryland event last month, where I'm sure we met a lot of you over there. We are looking forward to take this conversation forward and have the conversation with you guys about what different things we can do for your participants, for your audience. And today's discussion is going to be keynoted by Dr. Dilip Sarkar, who himself is an elder and has been practicing yoga. You can go to his YouTube channel. We'll put a link for that in the chat as well, and you'll find so many different videos. He's also there on Facebook. If I dare say, he's almost like a yoga celebrity on YouTube and Facebook. So you should definitely check out his channel. And we will be talking a lot about the applicability of the yoga for primarily for the older adults. That's the market that we are currently focusing on. And we are doing a lot of work with different certifying agencies like NCOA and industry lobby groups like Leading Age or Live On to ensure that the protocols that we are developing for the older adults, they are not only certified and confirmed as research backed and evidence based, but they are also as widely accessible as possible, so that any person, any older adult who is willing to take care of or to take advantage of these protocols, it is available to them. I think that's the least that we can do, and that's the goal of Vayu Shakti. So with that, I'm going to hand it over to my colleague, Mr. Vasumurthy. He is going to introduce Dr. Dilip Sarkar, and then we'll get into the demo and talk by Sarkar. So Vasuji, over to you.
Okay, thanks, Saurabh. So, good morning, everybody. Welcome to this celebration of International Day of Yoga. As you know, International Day of Yoga is being celebrated on June 21st every year since 2014. UN recognized this on that year. So, we are very happy to have you, all of you here. And we are very happy to have a thought leader in yoga therapy, Dr. Dilip Sarkar, with us, who is going to talk and demonstrate these yoga protocols today. He is a retired vascular surgeon turned certified yoga therapist and certified Ayurvedic yoga therapist, and he is one of the foremost experts in yoga therapy who combines his 50-year experience in Western medicine with his extensive knowledge of integrative medicine, including Ayurveda and yoga therapy. So we have a very qualified thought leader in our midst today. His bio is very long. He has had positions in teaching. He was an assistant professor of surgery at Eastern Virginia Medical School in Norfolk, Virginia, and chairman of Department of Surgery and chief of staff in the Portsmouth General Hospital. He serves in various national healthcare boards as past president of Board of Directors, American Heart Association, Hampton Roads Chapter, Virginia, life member, Ayurvedic Medical Association, National Association. So many such boards. He's on many boards, and he has practiced as 25 years of practice as vascular surgeon in Tidewater, Virginia. He retired from practice after some health challenges, and then he has been certified and has shown a profound interest in Ayurvedic medicine, yoga therapy, and devoting considerable amount of time to both these ancient treatments and how they can help in wellness of all citizens and senior citizens. So we are very delighted to have Dr. Sarkar here today. And before I hand over to you, I once again request all of you to turn on the videos if possible, so that we want this to be an interactive session, so that we can have a interactive yoga practice. And then in the end, after about 40 minutes or so, we will have a Q&A session. So we'll take your questions also in the end. So with this, I request Dr. Sarkar to start with the lecture demonstration.
Okay. So I'm spotlighted now, sort of. Okay.
Yes, Dr. Sarkar.
Okay. My dear sisters and brothers of Vayu Shakti, welcome. It is a celebration of International Day of Yoga. As you heard the Bhashamurti just said, it's the 8th International Day of Yoga. 2014, Indian Prime Minister Narendra Modi proposed this in United Nations, and the first time in the history of United Nations, the day was recognized by 178 members countries out of 193 and never needed a vote. So you can think what is the power of yoga in the whole universe. So primarily today, we'll be talking about the importance of this yoga practice for the seniors, and just give you a couple of ideas before we start and before we explain. For the seniors, the most debilitating condition is the pain, chronic pain involving all the bones and joints. And believe me or not, the pain does not come, what you think, from inflammation, arthritis, a damage to the cartilage, damage to the joint. People say, I don't have any cartilage on my knee joint. It's a rubbing bone to bone. I have a great news for all of you. Cartilage doesn't have a pain fiber. Bone itself may not have a pain fiber enough to create pain. Covering of the bone called periosteum, it has some pain fiber. So what happens in our body, that when you have the age-related degenerative process in all the weight-bearing joints, hip, knee, ankle, where you create a pain, body tries to splint it. What is splinting means, I have an issue, body will try to make it straight itself by tightening the ligaments, tightening the muscles. All the pain fibers are in the ligaments and are in the muscle. So what gets rid of the pain is a practice of yoga, which is called a relaxation response. In contrast to exercise, when you are running, when you are working, when you are weight training, it is a muscle contraction. It is a sympathetic overdrive. Practice of yoga is a relaxation response. It is called activation of parasympathetic tone. And as Saurabh was saying, that all of our lifestyle-related disorders today are from stress, are from called sympathetic overdrive. And yoga practice is a parasympathetic activation. So it's a wonderful tool for lifestyle-related diseases. Now, we talk about for the seniors because we talk about yoga therapy. Today, if you see, in Duke University has the world's best center for the seniors. You might check it out, all of you, especially Vasu and Saurabh. It's called Integrative Yoga for Seniors. You can even get a training. You can be a teacher in just teaching the seniors. Because another important factor for the senior is, people probably may know by now, the number one cause of death in senior people is not your cancer, not your heart disease, which we are all suffering from. It is the fall. You fall down, you break your hip, break your pelvis, downhill. So number one therapy we teach is a balancing poses, how to prevent a fall. You will see the elderly people will be walking, they'll be walking like this, they're walking like this. You know, it's not the fall itself, it's called fear of the fall. There's a plenty of study done. In fact, there is a big article just published in very famous medical journal called British Journal of BMJ, British Medical Journal. What they've shown in a 10 years research study, that a senior above 60 years, if they cannot stand on one foot, I will teach you how to do it the 1 foot standing, cannot stand in the 1 foot, even with eyes open, but we'll teach you how to do the eyes closed. For 10 seconds, the chance of their mortality, means dying, goes about 84% in next 10 years. So these are the tests, and I'll show it to you. It's called a sit-rise test. You'll be able to sit down in a squatting pose called Malasana and able to get up without a support. When you'll be able to do those, your pain, your fall, in fact, your chronic inflammation, the relaxation response, activation of parasympathetic tone is an anti-inflammatory, anti-thrombotic. It is a powerful tool for your, we call it manasthir, quieting down your mind. So what yoga does to us and the practice we do is that the yoga, the word itself, it comes from a root Sanskrit word called yog, or jog, means union. It unites your body, mind, and spirit. It's a philosophy. Philosophy is 196 sutras, called a small aphorism. But very interesting is, out of 196 sutras, 193 sutras are to quiet down your mind. So a real practice of yoga, remember, practice of yoga is not sitting down and trying to put your body in the shape of a pretzel. Practice of yoga is the understanding of the philosophy. And then the practice is called Patanjali 8 limbs, Ashtanga Yoga, 8 limbs. First one is social restraint, personal restraint. Asanas are called your external and internal alignment from a relaxation, not from trying. We say very simple. By the time I'll show you how to do it in stages, that when you learn how to do a therapeutic yoga, it's a Just let go. You don't try it, it'll come to you. It's a wonderful practice. It came to all of us. So it came to you. So there is come pranayama. Pranayama, people talk of breathing exercise. It is not a breathing exercise. Pranayama. Prana is a life force. Yama is a control and restraint. It's a voluntary restraint of your breathing. And remember, the prana, the life force, is a subtle energy which keeps us awake, alert, and alive. And breathing is not prana. Metaphorically, if you think about, electricity, prana will be like electricity and breathing will be like an electric cable. Breathing is carrying the prana to rest of our body does a healing, called a pranic healing. Fifth limb is called pratyahara. Pratya means reject. Ahara means your input. All the inputs we get through our five senses. I hear, I see, I smell, I taste, and touch. When you learn how to control your five senses are in yoga tradition called your mind. Mind is the content of your five senses. You quiet down your mind. Sixth limb is called dharan, which is a focus. You try to bring a focus, and we'll do it all this during our practice, you will see. Seventh limb is called meditation. So remember one thing, we all talk about yoga and meditation. There is nothing called yoga and meditation. Meditation is the seventh limb of yoga, and the eighth limb is called your samadhi, which is your union of your body, mind, and spirit. So what we do in yoga therapy, we use the same tool, but we pick and choose. We do adaptation based on our patient's clinical condition. Somebody comes with a physical nature, comes with a back pain, knee pain, hip pain, we might start very slow relaxation response. We let them sit down in a chair, sit down with their spine straight. We call Merudanda Achal, spine straight. And close their eyes, follow their breath, focus. It's called Manasthir. Mind quiets down. Somebody comes with primary your breathing problem, asthma, COPD, pulmonary fibrosis. We might start doing very gentle, very slow pranayama to start. Somebody comes with your neuropsychiatric disorder. We might start doing a little bit of very, low-centered meditation to start with. So able to learn how to use the same tool for different patients and different clients is called yoga therapy. Normal yoga teachers training is about 200 hours. For yoga therapy certification, training is about 800 to 1,000 hours. We are all certified. We're certified yoga therapists, but it is a big branch. And our first and foremost goal today is how to integrate yoga therapy with the Western medicine. So just want to show it to you. I wrote a book and it's very popular with all the medical community and healthcare providers. It's very well received. It's being published even now in India. It's being translated. It's called Yoga Therapy, Ayurveda and Western Medicine. Ayurveda is another philosophy which have the same root. It's called Vedas. And this is available in your Amazon.com. And we do a program for your healthcare provider physicians. So first, when a senior person comes to us, and we do a practice all the time, we have a huge number of people used to come to our class before, but pandemic, as sort of said, pandemic has retrained us. Now we are all doing from the home, but we're very comfortable now, able to do it from our home. The first thing we teach a senior person is called keeping your spine straight, called Merudanda Achal. I was just talking to Shorav and Vasu that I have a special chair which I'm sitting in, and in this chair, you won't be able to bend your spine. Your spine has to be straight. Now, second thing I always do, and is full of my book, is the explanation, medical explanation for what we do and connecting the dots. That's why it is so popular with the physician and healthcare people. Our skeleton is going to fall down in the front. So the muscles in the back is called paraspinal muscles. They're always contracting to keep me straight. So when I put my hand on the side, I feel like two stones sitting here. But the moment I keep my spine straight, I give a relief of the contraction, which is a relaxation response. Now I'm feeling my back. It feels like two pillows on both sides. The tightness, go ahead and feel it. If you're sitting down, feel on the side of your spine, you will see it's a tight piece of brick sitting there. And by the time you're able to sit down for a short time, and then you practice with your body's signal. What is the body's signal? First signal is pain. You do not cross pain. If you sit down straight and if you start feeling pain, you back off. Just bend a little bit. What will happen? Next day, you'll be able to do it a little bit more. It is called our habit forming. In medical term, it's called neuroplasticity. And the way we explain, if you keep on doing something for 10, 20, 30, 40 times, you will be able to do it. I'm sitting here. I'm not sitting myself. My brain is allowing me to sit because I've been doing it for a long time. So this is a special chair. This is called yours. Let me raise it up a little bit. You will be able to see better. This is called your kneeling stool. So in a kneeling stool, what you do, I have another chair here. Let me push it down so you'll be able to see it. And I recommend this thing to every seniors. In fact, I recommend this thing to all the IT people. You sit down with your knees and keep your spine straight. No way you'll be able to bend your spine. So what I do, I have this, my computer is on it's called a adjusting table. I have adjusted it so my keyboard is here, my monitor screen is here, and I'm always working with my spine straight. So think about it. In Sanskrit, the term is called Merudanda Achal. So after Merudanda Achal, what you need the second practice is called Manasthi, mind quiet down. So sit down in a chair, and mind in yoga is described as content of your five senses. What does it mean? I hear, I see, I smell, I taste, and I touch. If I put all the inputs in a bucket, that is my mind. When mind gets better processed, it becomes my intellect. It's called buddhi. When intellect becomes more processed, it becomes my wisdom. These are called yogic koshas or sheath, and you will learn it more and more when you're able to do it. So for our people who want to practice with me, you want to sit down, you want to be sure your feet is grounded. So a lot of people says, chair, I cannot touch my ground. Put something underneath. I request all of you to put a folded blanket. I really don't like the yogic props and yogic things because within a short time, you'll see your feet is coming down. You can able to unwrap the folded blanket and able to get down your floor very easily. But when you have a fixed, this called yoga whatever you guys say, this yogic props, yogic tools. If you use it, if you use it in a graded 6-inch, 4-inch, 2-inch, and beyond. So we practice, I do everything. I think if you've seen my YouTube, Saurabh has seen it, Prosper has seen it. I will do in my hardwood floor, concrete floor. I don't need even a yoga mat, but you start. Hand quiets down your mind. Hand connects your body and mind. In yoga, a best practice is called mudras. Mudras are a hand gesture. One of the mudra is called touching your index finger and thumb. There's a beautiful scientific explanation for this, but you can go to my YouTube. I have a whole session on mudras, and you can see. But basically, mudras controls called neurophysical connector. It connects our body and mind and guides our prana to the organ of healing. Touching index finger and thumb is called Gano Mudra or a Dhano Mudra. Basically, it's a meditation mudra. So this is the beginning of your yoga practice. The first component of yoga practice is able to sit down with your spine straight with no pain. In fact, any yoga postures you do or asana do, if you feel pain, you back off. Second instruction to the seniors, please do not take a pain medication. Please do not take a pain medication before practicing yoga asanas and pranayamas, because you will lose your protection. Second yogic concept is your breath has to be effortless. It is called the yogic koshas or shit. It's called annamaya kosha to pranomaya kosha. Physical body to your breath. If you do any effort in your physical body, it will show up in your breath. See, for example, I'm sitting here, my breath is nice, quite normal. If I start doing some spinal twist, I put my hand slowly, turning my head, at certain point, I'll feel my breath is catching. I'm so effort in breathing. What will be the effortless breathing? You'll be able to talk. You'll be able to even sing. No pain, effortless breathing, non-competitive. You are not competing with anybody. Even if you go to a class for the seniors, do not look at what the other person is doing. You look inside yourself. It's called introspection. Exercise is working out. And this is a nice word I use for you to use. Yoga is called work in. It's not work out, it's work in. It is called your self-realization. You develop eyes which turn backwards and you look inside yourself. Nobody knows what is going on between our body and mind except you. Yoga teachers can guide you. So lung is like a balloon. It has a 6-liter capacity. We only need 1.5 liter to keep it open. We have 4.5 liter of air which you can exchange. Normally we breathe only 500 cc. So we have about 90%, 80 to 90% lung as a reserve. So how do we do it? Sitting down with the spines, even in the chair. If you want to sit all the way to the back, keep your spine straight. Touch your index finger and thumb and put it gently over your knees. If you're practicing with me, you try and you'll see that effect, immediate effect. Control your 5 senses. The number 1 sense is our vision. Our eye is an extension of our brain, so close our eyes. Then we take the healing power of our breath. As I said, lung is like a balloon, and we only breathe 500 cc in and out, but we will be able to do it 4.5 liter. So the first practice is, if you want to do with me, breathe out first. Take a deep breath in, slowly, without any effort. Breathe out longer than breathing in. Keep doing it a couple of times. Breathe in, slow, and as long as you can without any effort. You'll feel like this is a normal breathing. And breathe out longer than breathing in. You can do it 2 seconds in, 1, 2 in, and 4 seconds out. Slowly, you will see very quickly. You'll be able to do 3 seconds in, 6 seconds out, 4 seconds in, 8 seconds out. We have been doing so long, we can able to do 8 seconds in, 16 seconds out. Remember, the first thing will happen to the seniors. You are going to lose your breathing reserve. The moment you will be able to practice this, and the reason is exhalation is parasympathetic, which is coming and cooling, and inhalation is sympathetic. So I'm in an age group where most of the people in my age group won't be able to do even 2 seconds in and 4 seconds out. It reduces the number of breaths. When you are able to reduce your number of breaths, you live longer. Example is, if you look at a nature, a bird, hummingbird, has a breathing rate extremely high. Or you can look at a dog, breathing rate 30 to 40 times a minute. Lives probably 18, 20, 25 years. A turtle breathes only 3 or 4 times a minute. Lives about 100, 200, 300 years. So the joke is, I said, my grandma used to say, God give you a fixed number of breaths. If you use it early, you're gone early. If you can slow down your breath, you live longer. So let's give an example to you. Just simply, if you can try, you can do it. I will be able to do 6 seconds in, 12 seconds out. So the moment I can do 18 seconds a cycle, my breathing rate is dropped down to about 4 or 5 a minute. Normally it's 15 to 16. Then what happens, this relaxation response, I want to show it to you really now. I get a saliva in my mouth. Saliva in your mouth tells you they have a parasympathetic activation. All of your gastrointestinal tract supplied by parasympathetic nerve. So I've been talking to you for about half an hour, 20 minutes, half an hour. My whole mouth is wet because I'm in a relaxation response. I'm breathing out first as far as I can to empty my lung. Then I'll breathe in with a count of 6 in, breathe out with a count of 12 out. It's a wonderful practice. Keep on doing it. Your muscles of respiration, breathing muscles, are called skeletal muscles. You can train them. Like as if you are doing a biceps curl, you can do it for 5 pounds. In 2 weeks, you'll be able to do 10 pounds, you'll be able to do 15 pounds. You'll be able to do it. 2 seconds in, 4 seconds out, 4 seconds in, 8 seconds out. And the best way to prepare yourself, especially for the senior people, let me show it to you a practice. This practice is called a prayer pose to the back. So you, as I said, all is relaxation. And believe me or not, we learned yoga from the babies. If you look at a baby, and I have a slides, in fact, I have all of them in my YouTube. Every baby will get up into a cobra pose, get up into downward facing dog. So babies are relaxed. Babies are always, breathing. If you look at a breathing, they will do belly breathing, exhalation longer than inhalation. And also when I sleep now, my wife tells me, I can see your breathing out is a lot longer. You will do it even in your sleep. It's called your neuroplasticity. Babies will close their hand. I don't know how many people have noticed. We make a fist like this. Babies will make a fist, thumb inside and close. This is called a Balo Mushti Mudra. Balo means baby, baby fist. Or this is called your Adhi Mudra. It opens up your upper part of the lung. So if you do it with breathing, like breathe out first, take a deep breath in and close like a baby fist. You will feel your whole body get relaxed. After a few times, you will see your finger, when the hand gets relaxed, see your fingers, you'll be able to do it. Try doing it with me. Your one will be tight, it don't go in. But when you relax, it'll go in, go ahead, and your hands will go all over like this. And it is not relaxed. So the prayer pose to the back, which is called a Paschim Namaskar, let me show you gently how you do it. Slowly put your hand to the back. See if you can see me now. Slowly put your hand to the back, wherever you are. Stay here, breathing out longer than breathing in. Do it about 5 to 10 breaths. In a short time, you'll be able to do this. After about a few weeks, you'll be able to do like this. From here, if you keep on practicing, this will happen more and more. You'll go all the way high up. And when you are high up, take a look at me. This is called prayer pose to the back. Sanskrit is called a Paschim Namaskar. It totally relaxes your body and mind. And in yoga, it is not a reductionist. Our Western medicine is reductionist. In yoga, when you're able to relax your upper part of the body, it relaxes the rest of your body. This, remember, a back pain, chronic low back pain. Back pain comes from your herniated disc or spinal stenosis, but it irritates a nerve. It causes contraction of your muscles. It will relax your knee joint, hip joint. It's a wonderful practice. In fact, I teach all your IT people. I said, they generally put down on the screen. It's a wonderful word they use called AFK, called away from keyboard. I said, put down away from keyboard and do your prayer pose to the back. So practice the prayer pose to your back. You will see your breathing will get better and all the pain component, what you have, will go away. Next, you learn another simple way. I will just show you about next 5 or 10 minutes, and then we'll take about 10 minutes for question and answer. We are very comfortable standing like this. You will learn how to put your feet together. When you put your foot together, then you go to the back against the wall, touch your hip, touch your shoulder, touch your head, keep your body straight in a wall. This is what they call a stick, Dandasana. And slowly put your hand all the way high up. The moment you're able to do it, all of the pain in rest of your body will go away. Keep your eyes closed, your mind will quiet down, your depression, all the neuropsychiatric causes. Another thing you will see, people who have a mental issue, first they will have a posture. They will have a hinge down, they won't be able to walk properly, keep your spine straight. From here, you learn slowly how to able to sit down in a squatting pose. In a squatting pose, if you cannot do it initially, you can use your hand. Wherever you can come down, stay here. In stages, impossible become possible. Next thing you'll be able to do it. Next you'll be able to do it. Why? We have done it. Keep your hands together, separate your fingers. Extend your wrist. Put your one elbow inside, other elbow inside. Slowly bring close to you. Keep your spine straight, eyes closed, breathing out longer than breathing in. I can guarantee you, there will be no disease will come to you. Your longevity, how long you're going to live, depends upon how easily you can get up without a support. It is called a sit-rise test. And we do it throughout the whole day. We'll sit down and we'll get up. We follow a daily routine. It's called dinocharya. Then you call a lifestyle. We want to have a lifestyle. Next thing we do, we're able to do the balancing poses. Initially, you're able to hold your hand and balance the opposite side. See, I'm right-handed, right-footed. I will learn how to stand on my left foot. Initially, I cannot do it. I can put my hand here in a chair and slowly take off. 10 seconds, 20 seconds, 30 seconds, 40 seconds. Then you'll do impossible task. Close your eyes if you can do it. If you're practicing with me, try. With your eyes closed, you'll be all wobbly. But if you can do it, plenty of research showed that your longevity is going to be more. Do it in the opposite side. 10 seconds, 20 seconds, 40 seconds. Close your eyes if you can do it. It'll be wonderful practice. Finally, this is the most challenging pose for the seniors. See, when you do the balancing, it's very easy. If you learn how to stand on one foot, other foot, you'll be able to do very easily, call your tree pose. Then for the yoga teachers, I can tell you one thing. When you put your hands here or hands high up with the tree pose, now you did tree pose with your prayer pose to the back, hands to the back. You will feel entirely a different balancing. Opposite side, always balance side. You know, here you put your feet below the knee, put it above the knee. And when you're able to stand for a little longer time, then you do balancing, a sign of your health. And I can tell you, very simple way, if you cannot do it, you're not going to live too long. As simple statement, I can do it. Cross your feet. When you cross your feet, you're going to cross the opposite side of your body. Crossing your feet, see if you can sit down and if you can get up. Try this if you're doing it with me. If you cannot do it today, don't get disappointed, because Vasumurthy said, I have been practicing what, for 50 years, 55 years, but I'm only 39 and old. You know, I never grow more than 39. Cross it opposite side. Opposite sides, if you can able to sit down and able to get up. Unquestionably, by the time you can come here, you're balanced, you will walk with your spine straight. You will never see a 90 years, 100 years old person with a hunchback. 90 years old person will be having a straight spine. And for the most youngest of the youngest get a challenge. I am the youngest of the youngest because you know who do I practice yoga with now? With my grandchildren, because my grandchildren teaches me yoga. This is the final. Able to sit down all the way to the ground. See if you can sit down in the ground. Try it with me. I cannot see all of you, but somebody else might see. From here, sitting in the ground, see if you can get up without a support. All the way to the ground, get up without a support. If you put your one hand, you lose 25% of your life. If you lose two hands, you lose 50%. If you lose hand and a feet, and then do it completely crossing opposite side. Remember, in yoga, health is defined as a balance of your body, mind, and spirit. More and more you have your balanced, and balancing mind is our both sides of the brain. So during pranayama practice, we do a alternate nostril breathing. Sorry. We'll do another day. But pranayama comes with your relaxation response, and you're able to breathe effortlessly, closing your eyes and slowly enter into your state of meditation. See, from here, I'm getting up without the support. I will sit down and I will show you in next 2 minutes how to enter into a state of meditation with practicing the 8 limbs of yoga. Once you are able to relax, like my whole body and mind is relaxed. I can turn around, I can do this thing. You know, it is called emancipation. You have a freedom. Before, something to pick up, I have to think 3 times to pick it up. And I can get down like this, I can do this, I can run with my grandchildren. It is a wonderful experience in your life. Alternate nostril breathing. I'll show something what essentially looks almost impossible, but you will be able to do it. Alternate nostril breathing, if any of you are doing yoga, we do it with closing our nostril. I close my one nostril, I'm closing my right nostril. I breathe out through my left nostril. I breathe in through the left nostril. Close my left nostril, breathe out through my right nostril. If you're doing it, you can do it with your nostril closed. Left nostril is controlled by your right brain. Right brain is cooling, intuitive. It's called your moon energy, Chandranari, parasympathetic. Right nostril is controlled by your left side of the brain, which is heating, analytical, sympathetic, and it's called Suryanari, sun energy. It activates both sides of your brain. Now what you will do, now you'll sit down with your, see, every morning, we also do what is called your jalneti. We use a neti pot to wash our nostril. Those are called our dinocharya, daily routine. In fact, this Saturday, I'm going to present for a physician conference a daily healthcare routine. Let me finish with one very simple way. I'm going to show it to you, you'll practice at home, that a meditative alternate nostril breathing. What does it mean? According to yoga, we have 3 bodies: body, mind, and spirit. With my physical body is connected to my body. With my mind is connected to my it's called a sthulo sharir, shukha sharir. Shukha sharir is called a subtle body, and a spirit is called a causal body. When I am totally in yoga practice with my body, mind, and spirit, I can close my eyes, I'll be able to see my whole body. See, my eyes are closed, I can touch tip of my nose, I can touch my head, touch my left shoulder, I can touch my left great toe. I don't need to see them. So I do the hand gesture called the mudras, put it over my knees, close my eyes, I bring my attention, my breath to my nostril. I do alternate nostril breathing without closing my nostril. I'm breathing out through your left nostril. Breathing in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. I'm just demonstrating it. You will be doing in silence. And by the time you'll be able to do it, initially it looks like impossible. You will enter into a state of meditation where all of your thought process becomes your in order. It is not thoughtless. You have all the repeat thought process, those goes away. And you finish all this practice, we call pumping and cupping. Take your hands, keep on rubbing your hands. Keep on rubbing your hands. When you feel the warmth of your hand, if you're wearing glasses, remove your glasses, take your hands, put it over your eyes, let the eyes take all the heat from your hand, and slowly massage your forehead, massage your eyes, massage your face. All the muscles of the face are attached to your skin. So they're able to relax your muscles. All the skin frowning goes away. Take your hand, massage your ear, earlobe, behind the ear, in front of the ear, and it is called a vagal activation. Take the hand, massage in front of your neck. It's called carotid sinus massage. Massage to the back of your neck, the two muscles called trapezius and sternomastoid, which gives a profound relaxing response. So message to take your home, spine straight, Merudanda achal, manas sthir, mind quiets down by able to control your five senses and keep your relaxation response, activation of parasympathetic tone with your physical relaxation, voluntary control of breathing and the meditation. Thank you. We have about 7-8 more minutes, hopefully, 8 minutes. I cannot read all this thing, and first
I will send you I will tell you the questions, Dr. Sarkar.
Okay,
So,
and first of
all, thank you for a wonderful, excellent session. So wonderful to, for your demonstration, see everything. Obviously, it's very challenging for some people, but over a period of time, people will get the, the experience and the mechanics that you are talking about. We have first question from Sarah. Her question is, can you please review the importance of breathing out longer than you breathe in?
Yes, because first of all, say lung is like a balloon, okay? And you have all the air within the lung. So I'm breathing in. So what I'm doing, all the air is sitting on the top of this called residual air. And a large number is within my nasal passage in the back, which are called the dead space. The air is not doing anything for us. So first, in all the yogic tradition, we breathe out first. Empty my lung, empty the balloon. When I empty my balloon, then I'll be able to breathe in. I can do it about 2, 3, 4 times. And more relax. And you always incorporate the breath during your asana practice. People always ask me, when do I breathe in? When do you breathe hold? No. Every asana for a therapeutic yoga, especially for seniors, you will be able to do as if it is a normal breathing. There will be no effort. Normal breathing is, you'll be able to talk, you'll be able to sing. So answer to your question, every yoga practice, you breathe out first before you breathe in to empty your lung. Okay, next one.
Next one. So Anybody else has any other questions? We can take one or two more questions.
I see a lot of things. What is all this in the chat box?
Yeah, I
cannot
think they
read.
wanted the name of your book. We have put the name of your book in the chat so people can order it
Okay.
from Amazon.
All right.
We can take
Book.
probably one or two more questions. Anybody else has any questions? You can unmute yourself and ask the question directly or put it in the chat.
Hello, I'm Husseina. My question is, how is there any guesstimation about being able to do the sit to stand without using the hands?
Yeah. Generally, what we have noticed is, it's called your time of neuroplasticity. Neuroplasticity means, like basically you can say what is a habit forming. Habit forming and maximum about a habit forming, we talk about 30 to 40 inputs. Like if I'm doing it, see, I brush my teeth with my right hand, okay? Now I'm saying I'm going to get a balance. I am using my brushing my teeth in the left hand. I always do it every single day. But the first day when I started doing it, my brush is all over here. By the time I will be able to brush, you know what happened? My right hand is doing like this. But by the time it took me 20, 30, 40 times, I can do it brushing without that. So for somebody, it is a body-mind practice. I've seen people doing it even in a few days, somebody even a few months. It's almost like doing we call it every asana pose, including your headstand. I have a famous yoga teacher. She told me it took me 10 years to learn a headstand. And I have people like, even in my age. And I said, oh, I learned it in 2 days. So I think it's a mind over body, but answer is between 4 to 6 weeks, you'll be able to do it.
Thank you so much. But if you have any knee issue, should you still continue to practice?
Yes, you should still continue. Knee pain, again, from the tightness. So look at what I'm doing. I'm putting my feet here. I may not be able to do on this one. So I'm in a chair. Sit down like this. When you're sitting in a chair, try this. This is actually I have a couple of nice videos on my YouTube channel. Take your one foot, put it in the top, and slowly you'll be able to wrap around. This is called Garurasana, eagle pose. We do it in the standing up. I'm doing sitting in a chair. Within a short time, the tightness of the knee joint will go away and you'll be able to prepare to go down. This thing, do it on the other side. So go to the other side and you can able to wrap around. And actually when I'm doing it, it may sound funny to all of, I'm even eating on a chair and table. I put my feet here, I'm eating. That is my part of my life. I incorporate this in my whole life. And that's what the yoga therapy practice is. So knee joint, don't be afraid. Do not exceed your pain. Even if you want to sit down and eat, if you're holding here, if you get a pain, you back off. But stay here. You'll be able to do it soon. Without pain, you'll be able to do it soon. And in yoga, a wonderful statement is, in stages, impossible become possible.
Thank you. That was very helpful, especially the sitting.
Yeah.
Sitting eagle pose was very helpful.
Oh, yes. And sitting down squatting pose will be changing. In Sanskrit, what it's called a malasana. That's the way you win excrete, even back home in India.
Yeah, thank you. Wonderful responses. It's everybody can improve their health and well-being. As Sarkar is demonstrating, you can sit, on the ground and get up, over a period of time. So it's possible for everybody. And there is a question on the name of the book. That is yoga therapy,
and Western medicine, a healthy convergence.
Yeah, it's available in Amazon.
See, look at the book. There's a picture called Albert Einstein and Rabindranath Tagore. And inside the book says that it's actually it was my wife's drawing. And inside the book says, is a wonderful statement. Front cover, a watermark. Albert Einstein and Rabindranath Tagore, when a scientist meets a philosopher, it is a sign of your health. When
Yeah.
science meets a philosophy, it is your health.
Yeah, there's one final question, Dr. Sarkar. For
Yes.
tendinitis or tendinosis, would you still avoid all pain in yoga if you do
No.
that? No.
See, every pain comes from tightness. Inflammation in the tendon is called tendinitis. So I have my hand, I have a contracture, Dupuytren contracture, my fingers are all curved, I still do it. How I do it? I will do gently, I'll put my hand wherever it comes, I close my eyes, I'm breathing out longer than breathing in. Breathing out is parasympathetic, breathing out is sympathetic. My wife wakes up in the morning, my hand hurts. I said, do this Balo Mushti Mudra with your breathing. Breathe in, breathe out. So remember one thing, if you say, I'm not going to do it, I'm not going to start, fine with me. Go take some Celebrex, Celebrex not there, take some opioid, take some medication, and start digging for your grave. You know, the first thing what we got achieved, I think Vasu didn't say much, I had open heart surgery 21 years back. For the last 15 years, I'm medication-free, disease-free. I'm enjoying a quality life. I'm like a, what do you call it, energizer battery, you know, wake up 5 in the morning, you know, I'm the whole day, go to the bed by 10, 10:30. But I'm enjoying my life. That is more important. If you take 2 medications, 3 medications, 5 medications, which most in my age group, all of them are in 10 medications. And all the side effects of medication. So I will try short of pain and in gently doing it.
Yeah, thank you so much. You know, you're inspiration to all of us. So now I hand it back to Saurabh for a word of thanks and then to Sarah.
Yes, thank you all so much. I really appreciate everyone joining us this morning for this conversation and also practice. If anybody has any questions, we'll be free to give some information for you all to contact the team. If you have any further questions, the recording will come out soon that we can share with you. You'll be able to share with your teams as well. Yes, and thank you so much for joining us. I really appreciated our time together this morning. I hope everybody has a great rest of the day.
Excuse me, doctor, can you show me the name of the book again closely?
Okay, and you could just put it Amazon, just put in the, it's in the available in Amazon.
Yeah, it's also in the chat.
Thank you so much.
You put it in the chat, you can get it from chat. It's also in the chat.
Okay, the last statement before I leave, we said, Saurabh and Vasu, you translate to all of them, we call it New Yoga Sutra. It's called Karo Yog Raho Nirog.
Do yoga and be disease free. So that's
and then yoga will transform you from rogi to nirogi to yogi.
Yogi, yes.
Rogi to nirogi, then to yogi.
Yeah, transformation from disease to no disease to enlightenment. So that is the path of yoga. So wonderful quotes, Dr. Sarkar.
It's called a path of transformation.
What a wonderful parting statement. Thanks a lot, and thanks a lot everyone for joining once again. Yes. Sorry. So thanks a lot everyone for joining. It was a pleasure to have you all, Dr. Sarkar. Once again, thank you.
Somebody's hand is raised.
Yeah, it's a clap sign. So
a clap sign. Okay.
Appreciation for you, Dr. Sarkar. Yes, thank you.
I'm appreciating myself too. Okay, thank you.
This is really awesome, and I would also like to say thank you to the Leading Edge Maryland chapter for allowing us to bring this to all of their members. We are obviously here to talk further. We are 4 minutes over, so we do want to close this session, but we are definitely available for any questions, any discussions. I did put the link to our website, Vayu Shakti. Please have a look. We have a very extensive range of elder care services available for yourself, for your members, as well as we also have services available for your staff members, which we call as a corporate energizer. So we do have a program which we call We Care for the Caregivers. So your own staff members, they are obviously overworked, they are stressed. and we have programs for them as well. So please do look at those, and definitely, if you need us to set up a meeting with you, we would be happy to do that. So with that, we are 5 minutes over. Thanks a lot, everyone. Really appreciate, and thank you, Dr. Sarkar, once again.
And also I can say to all of you, somebody, talk about Maryland. As I said, I moved to Bethesda, Maryland, and only thing you have to do, I have a nice statement at the end. I said, catch me if you can, you have to catch me, not be bought before time. I'm very hard to find. I'm very hard to catch. But once you catch me, like I told Saurabh was sending me all this information. But finally, when he caught me, I said, fine, I'm all yours.
Yeah, it's
Even
great to
anytime
have-
you want me, I'm all yours.
Yeah,
Okay.
it's
How
great to
great
have
to
an
have you,
expert
Saurabh.
like you in Maryland itself. So welcome to Maryland. We're all glad to have you in Maryland.
Thank you so much. Thank you very
Welcome.
much.
Thank you.
All right.
Welcome.
Thank you, everyone.
everybody.
Bye.